Hi, my name is Christian. I'll be doing the fluid and medication video. So first and foremost, we want to introduce ourselves to the patient. Our patient is coming in to get fluid and medication via amoxicillin. So before I even talk to the patient, I want to make sure that I have my calculations correct. So our fluid, we're going to be giving 150 mLs over 60 minutes with a drop factor of 15. This is going to lead to 38 drops per minute. And then for the medication, we have 15, our drop factor of 15, and we'll be giving 100 mLs over 15 minutes. This will calculate into 100 drops per minute for the medication side. So 38 drops for fluid, 100 drops for the medication. The things we're going to be using today is our gloves, obviously, alcohol wipe to clean the IV port, the Y port. We're going to be using this 92-inch gravity set. This is going to be our primary. And then our secondary set, and it's this one right here. So a little bit about the equipment is that we have, it's a little tied up. So we have our sterile needle. We're going to keep this sterile until we puncture the bag. This must always remain sterile. Then we have our drip chamber. This drip chamber is where the fluid is going to essentially hang in here. We're going to squeeze it. Once we puncture the bag, we're going to squeeze it until halfway. And this is where it's going to drop into. And then we have our roller clamp. This is our regulator. I have it all the way clamped right now, but essentially we roll it up to allow full flow. And if we want to regulate it, we start rolling it down. Depending on how much medication or how much flow we want, we will roll it up or roll it down. Then we have our Y port, which is right here. This is where we're going to connect the medication line. Before we connect it, we're going to clean it with the alcohol pad. We'll get into that later. And then we have our adapter. This is going to go into the patient's IV. So I'll leave this here. And then now the same concept for the secondary line is, we have the spike, keep it sterile. We have our drip chamber, fill it up halfway. Same concept. We have the roller clamp, roll it higher for more flow, down for fully clamped. The only difference is our adapter. This adapter will go into the Y port. So we have that. Now we have our bag, our fluid bag, and then our medication bag. I have them upside down because I already removed the caps, just because they're a little hard to, take out and stuff. Okay, so now we're gonna start. So I'm going to introduce myself, knock on the door, introduce myself to the patient. I am going to, identify the patient with 2 identifiers, provide privacy. I want to make sure that I check the patient for allergies, and then whatever they tell me, I want to confirm in the chart, just to verify the information that they're giving me. Then I'm also going to perform hand hygiene, and once I do that, I'm going to put on my gloves. No, these are actually in reverse. Okay, now that I have my gloves on, I've introduced myself, provide privacy, check the allergies, have the 2 identifiers. I am going to, before giving medication, I want to ensure the 6 rights of medication. So I want to confirm it's the right patient, right medication, right dose, right route, the time, and then also right documentation. So now that all checks out, I am ready to set up the IV. So I have my medication. I have my primary port here. So like I said, I already removed the cap onto this. So remove the cap, have the sterile spike. I'm going to insert it all the way. I want to make sure that I have my clamp fully clamped. So then now I can hang it. So I'll hang it right here. Okay. Move my camera just a little bit. All right, so I have my bag hanged, fully clamped. Now I am going to squeeze the drip chamber so fluid comes halfway. Okay, we get about halfway. And then I'm gonna slowly release the clamp and remove the cap on the adapter at the very end. The reason why we want to do this is because we want to actually remove the air from the line. So I'm going to stretch this all out and then put this in like a garbage bag because water is going to come out. So let's do that. Okay, I see it's flowing, getting all the air bubbles out. All right, got air bubbles coming out, and I got now have some drops. So I'm gonna fully clamp it again. All right, now that I have removed all the air from the lines, I'm going to want to essentially unclamp this and then count 38 drops for a full minute. So every minute, I want to see 38 drops in this drip chamber. So for the sake of the video, I'm not going to count entire minute, but I'll just unclamp this, and then to ensure 38 drops, I'll adjust it until I have 38 drops for a full minute. But for the sake of the video, let's just assume that I have 38 drops already right here. So now that's done, I'm gonna put a cap back on. And then, so this doesn't get kinked up, I'm gonna hang it right here. So 38 drops per minute, fully clamped, and it's hanged. All the air is removed from the line. And yeah, now let's set up our medication bag. So we have our medication label to identify the correct patient. I've also removed the cap on here for the sake of, well, it's a little hard to remove. So same process. I have the sterile spike. So I'm gonna remove this, leave it right here. Okay, now I'm going to puncture the bag. Get it all the way in there. Ensure that our line is fully clamped. Now I'm going to flip it and hang it. This bag I want to have 30 inches above the IV site. The fluid bag needs to be minimum 30 inches above the IV site. And then our medication bag is going to go above the fluid bag. So that's why I have it up here. Okay, now let's hang down. Let's get this line straightened out. So fully clamped, I'm gonna fill the drip chamber halfway with medication. Okay, now that it's filled halfway, I wanna remove the air from the lines. Remove the cap from the adapter, and then slowly release the roller clamp. This will allow the medication to flow, and you can see that it's dripping. So release a little more. Okay, it's flowing. Okay, I removed all the air from the lines. Now I'm going to fully clamp again. All right. So now the medication bag, I want to ensure that I have 100 drops per minute. So I'm going to slowly release the roller clamp, count for 1 full minute until I have 100 drops coming out every minute. For the sake of the video, I'm not going to count a full minute, but yeah. Unclamp, make sure I have 100 drops per minute. Once that's ensured, I'm gonna put this cap back on. Okay, now we're ready to connect it. Alrighty. So now we're gonna clean our Y port. So clean the Y port really good. Let it air dry. And then get our medication line. Unclamp. Twist, connect, and then connect it into the patient's IV site. So now that that's connected to the patient's IV site, I want to make sure that the patient doesn't have any adverse effects to the fluid or the medication, or simply just something wrong with their IV. So I'm going to check their IV site, check for side effects, adverse effects, ask the patient if they're feeling okay, and then from there on out, I'll dismiss myself. Remove gloves, hand hygiene from the room, and then that's the end of the video.